How much weight should you be able to lose in 1 month? It depends on what your metabolic state is. Some people lose very quickly and other people struggle to lose weight. If you are overweight, if you are obese, you can find that your metabolism keep you from losing weight too quickly. If you lose weight too quickly, your body will go in a weight loss stall in order to protect your body. Also, it protects your body for for reproductive function. With other words, if you lose weight too quickly, your body will go into a weight loss stall. But the main thing, Lala, is to remember what is the goal. The goal is to be healthy. And that's why I encourage people not to look at the bathroom scale, because remember, the bathroom scale measure water weight, fat weight, bone weight, muscle weight, inflammation weight. But you can often find that the bathroom scale will stand still, but you lose centimeters. And that's what you really want to achieve. If you take a measure tape around the belly, over the navel, around your waist, and you divide it by your height, it should be 0.5. If it's more than 0.5, we call it metabolic syndrome. And that has a 6.0 risk factor for heart disease. So that is the most important factor that you want to look at. But be patient, because some people are going through a healing process. You don't know what kind of healing processes is going on in your body. And your body's main concern is not the kilos, although however quickly you want to lose it. Your body's not concerned about that. There's other things that is important to your body, like inflammation. Like, for instance, your sugar levels, your hormonal levels, your insulin levels, your immune system, your levels of acidity in your body. So those are the things that are important, more important to your body than the weight per se. But be patient. You will start to lose more weight. I lost 12 kilos in 2 months. Many people lose less than that, and some people lose more than that. Depends. Kelly Hogan is a 12-year carnivore. You can Google her name, and you'll find many of her videos on my blog as well. And she actually picked up weight the first 6 months of being carnivore. Now imagine if she was only focused on losing weight. And she had quite a lot of weight to lose. Go and look at the pictures. Just look for Kelly Hogan. But of course now her body is perfect, and she eventually lost the weight. But in the beginning there was healing processes going on. But in her case there was reproductive function. With other words, she was trying to get pregnant, and she got pregnant. And many people testify to the fact that people that struggle, for instance, with infertility issues are being helped with the carnivore diet in that regard. Also, as I've said in many other videos, don't eat too much salt, and look at your acidity levels, because that can also be a factor. And then the thyroid, look at the thyroid. If you do a thyroid test with your doctor, let him look at your T3 levels, not only T4 and TSH levels, because those are the things that the doctors normally look at. But the T3 levels, they assume that the T3 levels are normal, because if you have sufficient T4 and TSH hormone. But T3, what if the T3 is not enough in your body? So that can absolutely cause a weight loss stall. I'm not saying you experience a weight loss stall. I'm just saying this is something to consider. Then also, something to consider is not to put sweet tastes in your mouth so that your cravings stay and kick you out of ketosis as well. Another thing is to eat fatty enough. And another thing is to not cook with unsaturated oils such as canola or sunflower, which will make you insulin resistant. But as I said before, too much salt will make you insulin resistant within 5 days. So don't eat too much salt as well. But to come back to your question, how much weight can you expect to lose? Some people lose a lot of weight, especially if they have a lot of inflammation. So what you will find is people lose a lot of water weight. I had people that lost 10 kilos within a few days, within 2 weeks, basically. It can be as radical as that. But in most cases, people tend to lose 2 kilos per week, but sometimes not. And that's what I said in the beginning, is you have to be patient with yourself, because maybe there's healing processes going on. Maybe you're still becoming fat adapted, because there is an adaptation phase for the carnivore diet. So I hope that answers your question. It depends on your metabolic health. Some people that are overweight may struggle to lose weight very quickly, and other people lose weight quite quickly if they want to lose weight. Remember, it's not always about weight loss. Some people want to gain weight, so that's also possible if you plan it correctly. I hope it answers your question, Lala. Also when one is exercising, you can speed up the body's metabolic function. And if you exercise, your muscles don't need insulin to utilize glucose to open up the cells for glucose. So you can absolutely improve insulin resistance by exercising. And as I said, metabolic function as well. Another thing that, as I said, with the uric acid, if you have high levels of uric acid, you should really try to eliminate the high uric acid, because what high levels of uric acid will do, it triggers the survival mechanism in the body, and that particular pathway is called the polyol pathway. It's where the body will use glucose and it will form fructose, and then it will store it into fat. And high uric acid levels trigger the body to do that as well. And as I said, hormonal functions, that can be another thing. But in the end, it's a long-term thing. The carnivore diet, Lala, is a long-term thing. It's not a diet where you lose a couple of kilos. That's what people always make a mistake, and they see the carnivore diet as just another diet. It's not. It's a lifestyle. It's the ultimate nutrition, actually, because it's the best nutrition that you can find. So you're basically eating the best nutrition that is possible. It's animal-based products. So you don't eat junk food at all. So you're not starving yourself. You can eat as much as you want. Don't overeat, but eat until you're not another bite full. Don't put sweet taste in your mouth. Cook with saturated oil, saturated fats. Don't cook with unsaturated fats, and only eat when you're hungry. Don't eat out of habit. Don't eat out of emotional reasons. See food as an energy source, not as some